Hi, I'm Stephen Golden, and this is my blog, Your Pain Free Body. Today, I want to talk about postural assessment. So often when I tell somebody that I'm a movement manual therapist, they ask me, well, what exactly do you do? Is that like massage? Is that like physical therapy? Well, the answer is I'm somewhere in between. Today, I want to talk about something that puts me a little bit closer on that spectrum to physical therapists and other medical practitioners. So let's talk about assessment. First thing that we're going to do when you come to see me for the first time is I'm going to have you come out in the hallway and I'm going to watch how you walk. I'm going to evaluate your gait. Walking and gait analysis is a big subject, and I'm going to talk about that in another video. So after we look at how you walk, I'm going to have you come in front of this mirror. So we're going to get somewhat of a subjective idea of what's going on in your body. We're both going to look at your body together so we make sure that we're on the same page and that we're seeing some of the same things. After we do that, we're going to come over to the grid chart. With this, we can get pretty close to a rather objective view of what's going on in your body. So obviously I have a grid behind me, and then I have this plumb line that's hung from this ceiling, which is lined up with the grid chart. With these references, we can get a pretty good idea of how your body deviates off of the horizontal and the vertical axis. And then with the combination of pictures, we can start to see twists in your body. So if you take a look at me, you might notice that my right shoulder is a little bit low. It's from an old rugby injury that doesn't seem to want to fully heal. You can also see from this view if maybe one side of my body was short and it was starting to bend my spine. You might notice that one of your hips is hiked up a little high. You might notice that one of the knees is collapsed in. It'll give you a good idea of your alignment. Take a picture. Always take pictures from the anterior view. And we'll take a picture from the lateral view. From the lateral view, you can really see how your body, how gravity is going through your body. A lot of people, when they get older, they start to jut their head forward. Their shoulders start to round. You can also see maybe if the pelvis is a little forward, a little back, and so on. Then we take pictures from the posterior and the other lateral view. So with those pictures, we have a pretty decent objective view of what is going on in your body. And I'll take these pictures every session. What that gives us is this amazing documentation to see exactly how you've progressed as we continue to work. Also, during some sessions, for instance, during the 10 series, sometimes the work will be subtle. Sometimes it'll be very, very dramatic. But during those subtle sessions, we can take a look at the before and after pictures. And often when I show those to clients, they don't have any trouble identifying exactly where in their body they've changed. After we've done that, have you hop on these scales. If you go to a physical therapy office, they have a pretty expensive machine that does the same thing that these inexpensive scales from Bed Bath & Beyond do. All right, so I hop on these and I see how much weight is going through my feet. People are really surprised that they're not putting the same amount of weight down through their feet, and often the difference is really big, as much as 20 or 30 pounds. With that information, we can really start to get really specific about where things are out of balance in your body, especially the lower half, especially the sacrum and the pelvis, the knees, the ankles, and the feet, and so on. After we have gathered all that information, I might have you go through a few more movement tests to assess things like joint mobility and range of motion. After we have all of that information, I'll have you up on the table and then we'll continue our assessment, assessing various things in your soft tissue. Continue to analyze what we see with what we are feeling on the table. With all that information, which is continual during all of our sessions, we can really create a comprehensive plan and strategy for you to bring your body back into balance and alignment, both within force of gravity and relative to the rest of your body. Really optimize your health and free your body up so that you can start to create your own pain-free body. Thanks for watching. If you have any questions, please leave them in the comments section. Again, I'm Stephen Golden, and this is Your Pain-Free Body.